I'm Dr. Nadeem Sajjad Raja. You are watching my YouTube channel, Dr. Raja Nadeem Sajjad Official. Please do subscribe my channel and press bell icon button. Today I'm going to talk about urinary tract infection. A urinary tract infection is an infection in any part of urinary system. For example, kidneys, ureters, bladder, and urethra. So any part of urinary system is infected in urinary tract infection. Most infections involve the lower urinary tract, for example, bladder and urethra. Women are at greater risk of developing a urinary tract infection or UTI as compared to men. In most of the cases, infections are limited to the bladder but can be painful and annoying. So when it spreads to the kidneys, then it has serious consequences. Doctors usually treat infections with antibiotics, but you can adopt other measures as well to reduce urinary tract infections. So what are the common signs and symptoms of urinary tract infection or UTIs? So first of all, person who is having UTI will experience a strong persistent urge to urinate, a burning sensation when passing urine, passing frequent small amounts of urine. Urine usually appears cloudy, putty, or mucky. Sometimes urine appears red, bright pink, or Coca-Cola colored, a sign of blood in the urine, and always there is a strong smell in the urine. Pelvic pain, especially women experience pelvic pain. So what are the common types of UTI and their relevant sign and symptoms? For example, if kidneys are infected, so that is called as acute pyelonephritis. In pyelonephritis, acute pyelonephritis, patient experience upper back and side flank pain, high grade fever with chills, rigors, nausea, vomiting. If bladder is infected, and UTI is limited to bladder, it is also called as cystitis. In cystitis, patient experience pelvic pressure, lower abdominal discomfort, frequent painful urination, blood in the urine, and if urethra is infected, then burning sensations while passing urine, discharge. So what are the common causes of developing urinary tract infections? UTI typically occurs when bacteria enter the urinary tract through the urethra and begin to multiply in the bladder. Although the urinary system is designed to keep out such microscopic invaders such as flushing. So infection of the bladder or cystitis. Usually infection in cystitis is caused by gut bugs, for example, E. coli or Klebsiella. Sexual intercourse may lead to cystitis, but who are not sexually active, they can develop cystitis as well. All women are at greater risk of suffering with cystitis because of their anatomy. All women have short urethra, so that means short distance from the urethra to the anus and the urethral opening to the bladder. So infection of the urethra, urethritis, this type of UTI can occur when gastrointestinal or gut bacteria spread from the anus to the urethra. So what are the common risk factors for UTI? UTI is common in females as compared to male. First of all, because of the female anatomy. As I mentioned, female urethra is short as compared to male urethra. Sexual activity, women who are sexually active, so they are prone to more developing more frequently UTIs. Certain types of birth control, so women who use diaphragm for birth control may be at risk of suffering with urinary tract infection. Menopause, women who are gone into the menopause. After menopause, a decline in circulating estrogen causes changes in the urinary tract that make women more vulnerable to infection. So other risk factors for UTIs include urinary tract abnormalities. For example, any baby born with urinary tract abnormality that do not allow the urine to leave the body normally or cause urine to back up in the urethra. So they are at risk of developing UTIs. Blockage in the urinary tract. For example, any kidney stones or ureter stones or enlarged prostate, suppressed immune system, catheter use for any reason or any procedure, or repeated UTIs, so that also make narrowing of the urinary system. So what are the complications of a UTI? So recurrent UTIs, especially in women who experience 2 or more UTI in a 6-month period or 4 or more in a year. Permanent kidney damage. Increased risk in pregnant women of developing low birth weight or premature infants. As I mentioned earlier, urethral narrowing or sepsis, full-blown sepsis. So how urinary tract infections are diagnosed? So analysis of urine sample. First of all, doctor will examine the patient, will take all history and examine. So after examination, doctor will do urine sample, blood samples, and will also suggest some imaging. And if needed, then they will use a scope to see inside the bladder. So first of all, they will do analysis of the blood. So they will check whether any pus cells or red blood cells in the urine. Sometimes bacteria are also seen under the microscope. So patient will advise, just to avoid the contamination of the urine due to the skin organism, so they will advise to wipe the genital area with an antiseptic and then take the urine specimen. Urine will also be sent to the lab for the urine culture. So this test tells us what bacteria are causing the urinary tract infection and which antibiotic will be most effective. Imaging, if necessary, then computerized tomography or magnetic resonance imaging will be done. So the treatment, antibiotic is the mainstay of the treatment to treat UTIs. So different antibiotics are used according to the culture results and sensitivity results, but most commonly used antibiotics are trimethoprim or trimethoprim, sulfamethoxazole, fosfomycin, nitrofurantoin, cefalexin, ceftriaxone. If these antibiotics are not useful or not effective, then one of the member of quinolones might be used. If any organism which is causing UTI is multi-drug resistant organism, then carbapenem will be used. But all medication should be taken on the advice of a specialist doctor or your doctor. So please avoid self-medication. If recurrent infection, so doctor will suggest low dose antibiotics initially for 6 months, but sometime may be longer. If there is a severe infection, then doctor will give intravenous antibiotics or antibiotics through vein. So drink plenty of water. Avoid drinks that may irritate the bladder. Thank you very much for watching this video. If you have any question, please write down in the comment section. I will answer. Thank you.